Hello, this is Dr. Eldred Taylor with the American Functional Medicine Association. And again, we're anxiously awaiting our November the 12th to the 15th meeting at the Georgia World Congress Center in Atlanta, Georgia. And as you know, we've had our little introductory interviews with all of our speakers. And today we have Dr. Tom Bayne, who is actually going to be a luncheon speaker. His company is going to be sponsoring lunch on one of the days of the event. And he is here, and we want to give you a little taste of what you might be hearing at lunch to go along with what you might actually be tasting at lunch. And so Dr. Bayne is here, and he is going to be speaking about spore-based probiotics. This is a subject that I don't have a lot of familiarity with, but that's what we try and do at the American Functional Medicine Association, is to bring you topics that you may not be familiar with, but we think that knowing about these things will help you help your patients. So Dr. Bayne, can you tell us a little bit about yourself and how you got into spore-based probiotics and what we can expect to hear and learn come November the 12th through the 15th.
Well, thank you, Dr. Taylor. I appreciate that. My name is Dr. Tom Bayne. I'm a practicing physician. I've been practicing functional medicine for 20 years, and my practice is mostly focused on digestive health. I've always had a focus on digestive health in my practice. And so we have been doing a lot of research with a number of different pharmaceutical companies throughout the years, and working with different varieties of probiotics. And so about 3.5 years ago, we teamed up with Dr. Simon Cutting. And Dr. Simon Cutting is at London University, and he is a preeminent probiotic researcher in the world. And he was the one that was the lead researcher that did the research in the UK, whether they were going to designate probiotics as a drug or as a over-the-counter, and that he was commissioned to do that study, and that led him to really do some interesting research with probiotics that are spore-based. Your spore-based species of bacteria, of probiotic bacteria, are the Bacillus species. And so there's three main points of differentiation from other probiotics in the market, and I think that's the simplest way to tell our story. One is survivability. The market is dictated by Lactobacillus and bifidobacteria-based probiotics. I don't dispute that those are the predominant bacteria of the human digestive tract. I do vehemently dispute that the way they get there is from oral administration. Those bacteria that live in your gut are anaerobic organisms. They don't come from your diet. They don't come from our environment. There's been tons of survivability studies that show that typical lactobifidobased probiotics just don't survive through the stomach acid. We're able to show that. At the end of the day, you still have an aerobic organism trying to live in an anaerobic environment. So even for those people that are going to say, well, mine survives because it's enteric coated, one, that would not hold to be true, because we'll show in the studies that many of the enteric coated ones don't survive. But aerobic organism can't live in an anaerobic environment. And so really we'll dissect the lactobifido story from a scientific standpoint and show through research like the Human Microbiome Project that science really doesn't support the theory of the reseeding theory of the bowel. Second point of differentiation is we have a lot of research on competitive exclusion with pathogenic organisms and immune modulation, actually stimulation of the Peyer's patches and the gall with particular pharmaceutical-based dosing of the spores. We're able to get stimulatory benefit to the Peyer's patches and the gall, and so we're one of two classes of probiotics that has any research with C. diff infections. The Bacillus species of probiotics have research with C. diff, and as does Boulardii. And so it's a tremendous competitive exclusion organism when it comes to yeasts, pathogenic bacteria, and so the last point of differentiation with spore-based bacteria is that their ability to produce nutrients. And so these bugs go into the digestive tract and they consume fibers, starches, and sugars in our digestive tract. And they produce as waste products the full spectrum of B vitamins, nattokinase, vitamin K2. One of the spores is patent pending for the biological release of carotenoids. So the bug actually eats fibers in your digestive tract and produces as waste products alpha-carotene, beta-carotene, zeaxanthin, astaxanthin, lycopene, and lutein. And it produces these carotenoid antioxidants at RDA levels right at the site of absorption. We're the only probiotic that's ever shown an increase in short-chain fatty acids in the bowel, and we were able to show a 39% increase in short-chain fatty acids. Tremendous implications in inflammatory bowel disease as well as cancer. But really, for everybody, it's really about shifting the body into a fat-burning mode from a sugar-burning mode. By increasing short-chain fatty acids, you improve the function of the digestive tract and metabolism in general. And so the only probiotic that we know of that's shown any ability to increase short-chain fatty acids, and we did it by 39%. So we have a lot of research ongoing that we're going to be sharing with you, some preliminary studies that went really well that have led to some clinical studies that are just underway. One's actually about halfway done, but the other one's just underway. So we'll be sharing some of the new research, and we have some other research opportunities in the pipeline that we're getting together and going through the IRB process, and so we're pushing the envelope when it comes to research in the field of the human microbiome, and we're going to be a leader in that research and in product and product development.
Yeah.
So
that's very interesting. I know there's when you start to hear probiotic ads on television, you know that there's something to it, but you also know there's a lot of latecomers trying to get in on the game. I know, functional medicine, we've been talking about probiotics in the gut for a long time, and now mainstream is finally trying to get in. But again, there's a lot of imitators out there, and I know I see a lot of patients who are on lactobacillus, and they think that's probiotic therapy, but there's hundreds of different organisms in the gut, and all of those things have to work together. I'm very interested in the fact that you've got studies that show it actually increases the activity of the Peyer's patches and all those things. So it really does increase overall gut function, not just reseeding. Is that correct?
So the interesting thing is that the lactobifido products that are out there, the reason that there is such a boom in them is because there's so many people with digestive issues.
Yeah.
And so it's the leading reason why people go to a doctor. And so, but what you have with the lactobifido is you have dead cell therapy. And the thing about it is that there are benefits to dead cell therapy, but it's symptom treatment. You're getting a transient benefit when that dead bacteria is passing through the bowel, some pH change, maybe some minor inconsistent immune stimulation. But with the spores, what you're getting is you're actually getting live action, where they're actually getting in there and they're living and existing in your digestive tract and creating an environment that's conducive for your own bacteria, the bacteria you got from your mom, to allow that bacteria to flourish and to grow. And what the science is saying is that we can't put bacteria back in. It's a highly specialized immune neighborhood, and it's not one that's just going to allow any bacteria to just come in there and live.
Right.
But what we can do is we can police the intestines, clean it up, get rid of the bad guys, and create an environment that allows the good guys to flourish. That's what's supported by the science. That's what's supported by the Human Microbiome Project.
Right.
That's some of the information that we were able to get from that research, is that you can't put it in there, but you can clean it up and make it a healthier place so that it'll, it's a garden, the gardening analogy. You
Mhm.
know, you got to work on the soil before you're going to get beautiful flowers.
Yeah.
So that's the whole idea is we can change the environment, but we can't reseed. That's not supported by science.
Well, great. Well, all right, Dr. Bain, this is going to be a great lunchtime lecture. Since we're going to be eating, we need to know how to make sure our gut is working correctly. So I think it'll go hand in hand. And this is some really interesting information. You know, I'm trained as an OBGYN. And I always joke that, you know, when I was OBGYN, I thought that the world revolved around the ovaries and the uterus. But I think everybody in functional medicine understands that health revolves around the gut. And I have become more and more a believer of that the more I get into functional medicine. So I think it's a very timely topic. And again, the more we can learn about how to make the gut more healthy, I think it's going to solve, you know, a lot of the problems that we see in functional medicine. So we look forward to having you here. It's only 3 weeks away, less than 3 weeks away now. We're so happy you decided and your company decided to sponsor the lunch. And we'll be sending this out to our attendees and our potential attendees, and I'm sure we'll all be anxiously awaiting to hear from you come the conference. So thank you again for taking your time out, Dr. Bain. And again, we look forward to having you at our conference this year.
Thank you, Dr. Taylor, for having me. I appreciate it and looking forward to it.
Okay. All right. Thanks a lot. Bye.